If you've struggled with stress, balance, or burnout, and simply feel discouraged or even defeated, and if you're ready to move from force to flow and enjoy ultimate Zen success in your career, health, or relationships, then the Zen Success Show is for you. Your host, Carissa Sims, is an entrepreneur, corporate consultant, best-selling author, meditation teacher, and healer who has found her own Zen success. Here's your host, Carissa Sims.
Welcome to this week's episode of Zen Success. Today, I have the pleasure of speaking with Dr. Glen Robison. Hi, Dr. Robison.
Hi there.
And what do you like to be called? Do you like to be called Dr. Glen?
That's fine. Yeah, whatever is comfortable.
Okay. Well, let me share more about Dr. Glen Robison. He serves as a diplomat of the American Board of Multiple Specialties in Podiatry. He is board certified in primary care in Podiatric Medicine. Dr. Robison is a Jin Shin Jyutsu practitioner. Oh, and certified Myopractor. I know about Jin Shin. Wonderful. Trained in releasing deep restriction of motion in the body that resides at the root of our symptoms and ailments. He has an Amazon bestseller, Healthy Dad, Sick Dad. What good is your wealth if you don't have your health? And I agree with that. And he also is a USA Today best-selling author, anthology book, Luminary Leadership: How Top Entrepreneurs Lead in Business and in Life. Inducted into the prestigious Marquis Who's Who, Dr. Robison leads his medical specialty in the area of Prolotherapy for stabilizing ankles, repairing torn ligaments and tendons, along with reducing bunions without surgery. He is also part of a medical mission to the Kingdom of Tonga. So Dr. Robison currently operates his private practice of 25 years in Mesa, Arizona. So happy that you're here with me on the Zen Success Show.
Glad to be here.
Yeah, wonderful. So can you share a little bit about your journey to where you are now?
Sure. When I was a kid, as odd as I was, at the age of 10-ish, I was on this mission to find a cure for asthma. So I'm writing my memoir right now, and I'm trying to describe to the reader, like as a child, to breathe through a straw. So that was my life. Every night, I seemed like I had an asthma attack. I was kept out of sports because of asthma. And so at a very young age, I was on this mission to find a cure for my asthma so I could be like the normal kids. And so I would do things to myself. I mean, I'd dribble basketball on dirt roads for miles and miles and trigger an asthma attack and record how far I could go and record what foods I ate and jump on my bike and ride to the next town and do all these things. And so that was I think my goal. And when I got into high school, I'm sitting in front of this high school counselor, and he just looked at my ACT score and says, "There is no way you're going to go to college. I mean, you just got the lowest score in the ACT in the state of Utah and the fifth lowest in the nation." He said, "Good luck getting into college. Go be a farmer like your dad." So I'm putting a lot of many years into where I'm at today, but I set a goal at that point to get into college, and I made the goal, got into school, and I just had some great people along the way that helped me, direct me where to go. I still wanted to find that cure for asthma, but when I stumbled upon my gross anatomy class in college, and I was dissecting the whole nervous system from the head down to the foot. And when I got to the foot, I was like, "Oh my heavens, there's so many things in here." And I started opening up.
That's fascinating, right?
Started opening up.
Where did you go to school?
I went to school in a little private college in Idaho. Yeah,
Idaho. Okay.
called Rick's College
Cool.
at the time. Now I think it's a university. So, but they offered this this course, gross anatomy, and only a few select students could be in there. And so I chose to stay an extra year there and just to take this course that I would go in at nights and just dissect. And no supervision, just me and the cadaver. Um, and and so it was intriguing. It was an eye-opening experience to me. But man, I tell you, when I got to that foot and I opened up the skin and I saw all the bones, all the tendons, all the ligaments, all the nerves, it was fascinating. And I started to explore, okay, I broke my ankle in the 8th grade. Where did I break it? And so I kind of deviated from the nerves and went over to the ankle joint and started to say, okay, this is the bone that I broke. And when my advisor looked at the work I was doing, he says, "Man, you should be a podiatrist." I go, "What's that?" So I looked into it, and I had interviewed with a allergenist, and I went and I sat in his waiting room, and he brought me back, and I saw him work with a few patients. And when I left his office, I was just like, this is not for me. And so when my advisor says you should be a podiatrist, it kind of like, oh, whoa. So I went and worked with one. And I was like, this is intriguing because you get to work with kids, you work with adults. I mean, I had in my practice, I had a day-old that was born with an ingrown toenail. So I did a surgery on a little 1-day-old child. And I had a 110-year-old patient just last year that I seen right before she passed away, and I was treating her. So the gap of 110 years, that's my patient so far, that age gap. So it's very
Wow. So they
exciting.
don't have like a pediatric podiatrist. They just,
Um, there are podiatrists that solely specialize in pediatrics.
okay.
As for myself, it's general clinic, so I will
Yeah.
see anybody and everybody in clinic. Doesn't matter their age. Yeah.
Oh, that's amazing. I love that. So, how did you go from being trained as a surgeon to helping clients in a more holistic way?
So when I got into medical school, everybody was geared for surgery and everybody wanted the top surgical residencies. And I actually got a surgical residency and I was trained to fix bunions, trained to fix hammer toes. I never really got into the heavy stuff of fusing ankles, things like that. That just didn't excite me. But I was fascinated with uh, doing ankle surgeries. But it wasn't until it was probably, I'm trying, 4 years into my private practice. Um, and I had my second child, a little girl. She was about 2 years old. And she looked at me one day and she says, "Daddy, please help me." And she says, "It hurts to eat." And every time we fed her, it was very painful for her. And so days went by and weeks went by, and she was just losing weight and she wasn't eating right. And so here, this Western medicine mind of mine, I took her to the ER, took her to the
Yeah.
pediatrician, took her to the other specialties, and they had no answer why
Oh,
she wasn't eating. And so I was like, oh, well, okay, I got to find something. So I actually stepped out of the things that I was trained in and found an alternative specialist and called him up and said, "Hey, look, here's the situation. Can you look at my daughter?" He said, "Sure, bring her down." So I brought her down to his office, carried her in, laid her on the table, and I had to sit back and trust that this man would, do his thing. And she, I'm sitting there and he's doing his work, and all of a sudden I start hearing gurgle sounds, and then my little girl stood up and said, "I'm hungry." And so we went and fed her, and she had no pain. So whatever he did intrigued me enough to start asking questions and said, "Look, I need to learn this." And they never taught me this in medical school, never taught me in any of my schooling. So he agreed to teach me what he learned over his course. And that's kind of like the prefaces of the book, Healthy Dad, Sick Dad. Healthy Dad is my mentor, who I studied with
okay.
for 18 years. And
Wow.
sick dad is my biological father, who I saw pass away right before the book came to be because of a heart
Oh,
attack. So I
that's
learned
profound. That's
both
profound.
worlds of health and that. But it's amazing that it took my little girl to change what I was doing. I'd been trained to cut and trained to do this. I even went to Tonga and had some incredible experiences in helping people surgically there. And then it was just shortly after that's when my daughter came down with this pain that was unexplained.
Mm. So what was it what did he actually do to relieve this pain?
So in a chiropractic world, I've never been to a chiropractor, but they do adjustments.
Hmm.
So I can only kind of explain how I see it. And so he had her on the
Yes.
table. First off, he did something interesting. He checked the pulses of her wrists, and it's
Ah,
called pulse diagnosis.
okay.
And so you can actually tell an individual where the blockage or the area of interest needs to go from the right and left wrist. And there's a superficial pulse and a deep pulse. And so when after he got done with that, he positioned her on the table and did this little, I call it the pretzel, and twisted her, and you heard this little pop, pop, pop in her mid back.
Oh my
And
God, that's amazing.
yeah, and that's when I heard the gurgle sounds. And so in my kind of medical mind, I'm like, okay, something had shifted in her rib cage when she took a fall or something happened out in the yard. And it was confirmed to me by my mentor that, yeah, one of the ribs had subtly shifted from a fall that was pushing in on the nerve plexus to the digestive system. So every time she was in pain, when she ate, that was the cause. And so when you release that, there was no more pain. And so when we gave her food, she had no pain at all. And yeah, it was a pretty amazing thing, and that's all it was. And none of the ER, like I said, none of the doctors could do something like this. So
That's incredible. I love that. Was that straight chiropractic work
no,
or did
it's
you
called
do
myopractic.
Oh,
So
myopractic.
yeah,
Okay. I
so there's
hadn't
a
heard of that.
difference. Yeah, there's some great chiropractors that do adjustment, but in myopractic world, you bring the joint to tension and then you release it. It's not a forceful release. So you actually prep the tissue, you prep the area, and there's a little more time involved, and it's all about feeling. And so sometimes when you're doing like the cranial work, it's a little more finesse. When you're doing the mid back or the hip, which is more dynamic, there's a little more force, but you still have to prep the muscle tissue, get the blood flow to the area, and then it's a feel. It's all about feel, and then you just release it.
That's interesting. And how did you find this person that is the inspiration behind your book, The Healthy Dad? How did
Well,
you discover him? Was he a referral?
he was a referral, and I will talk about this, yes. And the reason why there's hesitation, because out of every kind of nightmare thing that people encounter, there is also blessings that happen. So the reason why I say that is the woman that I was with, that I'm no longer with anymore. I went through a divorce. Um, she introduced me to this man, and so at the
Okay.
beginning of our marriage. She said, "Here, look, there's this guy that could probably help you in your back." So I was a little familiar with him, but I was still dead set on Western medicine. And so, like when I took my daughter in there, because I've had a little prior experience with him, with myself, and I've seen my wife get worked on. Um, that's how I was introduced to him. Now, even though we're not together um, at all, I still am so thankful that I had that opportunity to meet this man that actually just changed my whole entire career. But had I never been married to this woman, who knows? I'd never probably met this guy. So
Mm.
short
Yeah, the
story.
blessing. And
Yeah,
how old was your daughter at the time?
she's about two and a half.
Oh my God,
Yeah.
like a little
Oh
baby.
yeah, she's
That's
a little porcelain
amazing.
doll. Yeah.
Yeah, because I took my son to cranial sacral therapy and maybe it's similar to myopractic, is it? I
Yeah,
can't think.
there's cranial work in that. Yes.
It's cranial work in that. Yeah. And it helped his flat head so he didn't have to wear a helmet.
Yes. Yes.
And I was grateful for that in one session. And he was just a baby, like
Wow.
9 months.
So if can I tell you this one experience?
Oh, yeah.
Okay. Because we're on it. So my little girl who had that experience, well, with my mentor, we found that one of our hips was caught, and so meaning that the femur head was not in the full acetabulum of the hip
Oh.
joint.
Uh-huh.
And so there's a technique I even use in my clinic now. I can tug on the legs and I can see if one of the hips are caught. And if the hips are caught in children, they'll have digestive problems, so they're more constipated and things like that. Well,
Oh, fascinating. I didn't
yeah.
realize that connection. Okay.
Um, but there was one day I'm in clinic, and this mother brings her child in, and she's probably around two and a half, 3 years old. And I'm watching this child with, pardon me, with her mom, and the mom has her daughter's hand, and they're walking down the hallway. And I'm looking at the daughter, and one of the feet, her foot is pointed straight forward, and her other foot is at 90-degree angle. And so
Hmm.
she's walking down the hallway like this. And
Mm.
I'm looking at this, her gait, I'm looking at that. And then they put her in the exam room, and I do my little testing. And sure enough, she had one hip that was free and the other one was caught. The 90-degree angle was caught.
Hmm.
So I told the mother, I says, look, there's two things you can do. One, you can have surgery and break the femur and go in there and pin it, which they do. That's what they do medically. Or you can allow me to, do this type of manipulation, which is kind of out of my realm of podiatry, but I've been trained in it, I've done it. And she says, whatever you can do it. So I walked her through. I said, "This is what I'm going to do to your little daughter." I laid the little daughter on her stomach, and um, I did the little manipulation. And you hear this big
Hmm.
pop in the hip, and then I leaned her back over onto her back and gave a tug, and it was free. And so I lifted the child off the exam table, and I said, "Okay, walk to the door." She walked straight, and her mom got these big eyes and says, what did you do? And I says, no, this is great. And the little girl was walking straight. And so what was really heartfelt experience to me was a year later, I had a follow up with them, and this little girl came running down the hallway and gave me a big hug. And, and it was all worth it. I mean, just to see this girl walk normal without no surgery. And she would have had a lot of problems down the road had she not had that done. Um, Now, there are procedures that they put little kids in a brace, but there's a certain age
Yeah,
that if you can get them. But no, that was quite an experience to me. So, yeah.
that's amazing. And are you still doing that type of manipulation?
Oh, every day. Yeah.
Oh, every day. Okay. So
Yeah.
now you're transitioned to that more than just focus on podiatry, correct?
No, so what I integrate it in my podiatry. That's what
Okay.
makes me so unique in what I do.
That
So,
is very unique. I have never heard of that.
yeah. I mean, I
Amazing.
just had a guy today that come in. He was in pain. He had this called piriformis syndrome or sciatica,
Yeah, I know what that is.
and And so I was working on him, and after it was like his CC joint, I call it calcaneal cuboid joint. It was just disrupted and not tracking right, and I released it. He walked out of my clinic pain free, and he was like, "Oh my heavens, I've been suffering this for months and months." And so I've been following him, and today he had gone 2 months without any pain, and he's like, "I'm walking 8 miles a day. I'm hiking. This is the most fantastic thing." He said he started to see some little soreness in the buttock area again, and so I did another release, which it came out again, and he walked out of here pain free again. So a lot of times
Wow.
I do this with my patients. So when they come in with knee pain, I look at the ankle. When I do prolotherapy, I always make sure the joint's tracking right. So I'll release the ankle, release the midfoot. If people have lateral pain in their leg, it's always that ankle that's not tracking right. So, there are
Mm.
millions of sprained ankles every year just in
Yeah.
America. And there's a subtle
Wow.
shift in that joint that nobody picks up on. And so in my profession, I've talked to my colleagues. What they do is they'll go in and do surgery, and they'll suture a lot of the ligaments together in the ankle to strengthen them, but they never address this shift um, of the ankle. So yeah, I integrate it definitely into my practice.
I see. So when you're analyzing someone, how do you start? Do you start with their gait so you can see how they're walking?
The very first thing, I just listen. I
Oh,
listen
listen.
to what they tell me. So, I mean,
Okay.
there was a professor in one of my neurology classes, and he made a statement. He says, if you just listen to the patients 94% of the time, they will tell you what's wrong with them. So if a patient comes in and say, look, I've been to 6 or 7 doctors, which is very common in my practice, and they don't know what's going on. That is one of those light bulbs in my head. And then I first go for the marker, and it's a little area behind the knee that if it's really sensitive, I know their knee, I know their ankle or the midfoot's off. And so then I have to take time prepping them, and then I'll release it. So a classic example, there's a condition called tarsal tunnel syndrome. It's kind of like
I know
carpal
about
tunnel.
carpal tunnel syndrome, but not
So
tarsal.
it is identical, but in the foot. So in carpal tunnel, it's right here. In the foot, it's in the inner side. And you'll have burning pain that shoots up the leg or burning pain that goes into the heel. Well, classically, whenever I see that nerve that's inflamed, I know something's not tracking right. And so I just go right to the source and just release it and get the ankle or the midfoot tracking right. And usually that fixes a lot of the condition.
Well, I'm really impressed about you. I know you probably healed a lot of different disorders and pain, but the piriformis disorder, that's really impressive because a lot of people, I have a background in ergonomics. I'm an
Okay.
occupational therapist. So a lot of people have that, the sciatica and the piriformis pressing on that nerve. And gosh, maybe it's just a misalignment and they need
Oh
to be
yeah,
adjusted.
absolutely.
Oh my God.
If they have tenderness between the third and fourth toe,
Uh-huh.
push between the third and fourth toe. If they have tenderness in there, it's their hip.
Ah, I see.
So in my profession, it's called a neuroma, interdigital neuroma,
Hmm.
but usually that hip is not tracking right. And so when you're dealing with a hip, it could be three things. It could be that femur head, it could be the iliopsoas joint, or the pubic bone. And so if it's not the femur head, which 80% of the time it is, then you have to go deeper into various levels, and there's more prep work, and there's different techniques to release the pubic bone. And
Ah,
so somebody that hit, their tailbone, fell down, or, giving birth to a child,
yeah.
the classic, pubic bone shift. So
Oh, right. That
these
makes
are
sense.
all things that I will look for. So
Hmm.
now, um, yeah, I have to be careful with what I say because in Arizona I
This
can
is
only
not medical advice.
no,
We
I
have to do
treat,
that disclaimer, of course. We'll
yeah,
put that
I
in the
treat
show
to the
notes.
knee, but if it needs extra work, I say, look, I can't charge you for this. I can't do this, but I'm trained in it. I have a certificate in it. So that's when I start working on the hip in that area.
Yeah,
I do step out of my podiatry realm and work on that. But except
I
for
see.
that little child that I just didn't want to see get surgery, so I just released it. So
Yeah, that makes sense. And so now I'm thinking about my son, he's 13 now,
okay.
and he rolled his ankle just yesterday. And he has feet that are a little bit pigeon-toed. So I'm wondering because he said he hurt it, he rolled it when he was doing this activity, when he was jumping up and when he came down. And I was thinking that his foot probably was not in alignment when he came down.
Oh yeah, correct. Yeah. So look at the perineal complex, the perineal tendons coming off the outside of the leg. See if he's sensitive there.
Yeah.
Feel for
You know,
the
you're telling us to do how to do this at home, how
no.
to do it on my own.
I'm just saying that as a mother, just you can push on these areas and say, okay, this is what's it's involved, but because of that ankle sprain, um, um, there's a shift. There's something that went on in that ankle that's now not going to be stable, unless you get that freed, and then depending on how much laxity or flexibility he has in that ankle, um, I'd have to see it, but that's where prolotherapy comes in and is
Yeah.
really dynamic tool that I use.
Oh, that's amazing. I have a feeling he has flexible ankles because I have flexible ankles. Like I can literally land on my ankle and nothing happens. Like he said it hurt, but it was not swollen or red or anything. So I thought that means he probably has flexible ankles, right?
Well, can be, but
Can be.
does he still have pain in that ankle?
No.
Okay, so a lot of times I'll see fractures that are not even swollen and they're very tender on the ankle because of the
Oh.
flexibility. And I'm like, oh, well, they have a fracture. And so it's very uncommon, but you do see a lot of swelling with it. So,
Oh, I see. So that's something to look out for.
yeah.
Well, I'd love to hear about a story of your own experience when a bunion appeared and you didn't want to have surgery. What did you do?
Okay. So when I talked a little bit about that divorce I went through, my
Yeah, a
life,
bunion happened
my
because of a
life was
divorce.
current is directly proportionate to the divorce. And here's
Really?
yeah, absolutely. And
Okay,
here's
now
my
you got to explain that too.
okay. I tell patients bunions are really okay. I'll back up. In school, they teach us bunions are genetic. Okay, if mom, dad have them, grandma, grandpa had them, you're going to have them. My saying is, yes, that's true, but you're just as stressful as they are. Bunions are associated to a stressful event.
Oh, I see.
Bunions are directly associated to stress. And so, classic example, right after the divorce, my right bunion started to go south. And I'm trained to fix these things and have them surgically repaired. But in my mind, I'm like, I don't have the downtime of 6 to 8 weeks to have that fixed.
Yeah.
I could be off work.
You
And
have
two,
clients that depend on you, right?
right, I don't want to go underneath a knife. So I'm like, okay, what do I do to fix that bunion? Bunions are always opposite shoulder. So whenever I see a patient come in and they have say a right bunion in my case, their left shoulder is very tight and tender from their neck to your shoulder. So I always have
Oh,
them work their neck and shoulder, whether
okay.
it be massage therapy, heat, but you can always see in the feet where things are going on in the body. Hammer toes
Mhm.
are always same side shoulder tension. Bunions are opposite side. So
I
I
see.
knew in my mind if I could relax my shoulders, breathe, work it out, get some little adjustments, and then I came up with a 3 point stretching technique to work the bunions. Um, and then I decompressed the main bunion joint. Um, people don't go on to have bunions. And so you can't
Wow,
even
that's
tell I have a
incredible.
bunion. Yeah. I had a little girl that came in for an ingrown toenail, and I noticed she had a bunion. I says, "Hey, look, do this for me, and in 2 weeks come back and see me." And so I showed her 3 stretching techniques. I had her work their shoulder. I decompressed the toe joint. And when she came back, I had to do a double take because you couldn't even tell that she had a bunion. It was gone.
And you taught her how to do it. So she did
Oh
it
yeah.
herself.
All my patients have to participate. I had a 70-year-old patient that just came in last month and she didn't want surgery. I says, okay, you do this. And she came back. Now she had a little bump, but she had no pain. And she's like, this is fantastic. And so there's no surgery for her. So I've done hundreds of these things, patients that have come in over the years.
And how long does that typically take
It
to
depends on
remove the
how
bunion?
stressed they are.
Yeah, like for you, how long did it take?
For me, it took probably 3, 4 months.
So you need to be patient sometimes.
Oh, you have to be the patient. Yeah.
You have to be the patient
And
and
be
show
patient.
patience.
Yes, that's what I
That's so funny. I never made that connection, that play on words. Be
Yeah,
patient. Wow.
yeah.
That's profound. Okay. Got it. Got
Here's
it.
another play on words. You know why they call it practice? Because you're always practicing what you're doing. So no, I just kidding.
Yeah,
I
yeah, yeah.
I
No,
do
that's great.
everything on myself before I do it on a patient. So yeah.
Yeah, amazing. So, what other holistic measures do you use in your practice? Like, because in your bio, you mentioned Jin Shin, and then also I was wondering about meridians and Chinese medicine.
Okay. So with the Jinsen Jitsu, I use that as one, I need to relax the patient. So there are pressure points I use to calm the muscle down.
Okay.
Two, I will use it, integrate it extensively. Like I just last week had a patient that was ready to pass out on me after doing a little procedure in the office. And so you hold both ankles right below the ankle bones, and there's 2 pressure points, and you cross your arms, and it takes all the energy out of the head and sends it right down, so you can stop them from passing out. So I incorporate a lot of this into my practice. When I do it outside the practice, then I can do things like reversing Bell's palsy, which is the stomach meridian that's off. There's a lot of other things. In fact, I had one of my staff people. She was ready to have a baby, and she did not want to be induced.
Yeah.
And so on Friday after clinic, I says, okay, look, let me hold these points, and we'll see if it works. Well, I got a call the next morning on Saturday at 7 in the morning. She had gone into labor and had the baby before 7 in the morning, and she called just to tell me, oh, the baby came. And so um, she was supposed to be induced on Monday. So I held these points, and it worked. So there's a lot of things there. As far as Myopractic, we already talked about that. I do an
Yeah.
awful lot about that, but extensively. If there's hip pain, I look at the ankle. If there's outer leg pain, I look at the CC joint or the midfoot joint or the ankle, and I always check in the hip. And if that hip is not in, that's hard to get released, then you always have to look at the mid back, called the nines and ginseng, in the opposite atlas area. So it's more extensive. As far as there's another modality I use with the meridians, Chinese meridians, it's called thought field therapy, TFT. And
Oh, okay.
so
How does that work?
you just tap. So like
Oh, it's
right
tapping.
here, this is a classic area for anxiety, right
Oh,
underneath.
really?
So with patients that come in and just horrified of needles and they do not want to have that shot, whether it's a kid or an adult, I just have them tap here on the side of the hand, which reverses whatever experience they had. I just
Mm-hmm.
have them tap there 15 times, and then I have them tap here. And this is
And
the
it's
area
15 times too?
for anxiety, yes.
Oh, okay.
And then after I'm done, I'll tap between the two eyebrows, which is trauma center, so it doesn't seed that event into their deep memory. and
Okay.
they do much better. In fact, um, I had there another lady that she came in. I didn't realize she had brain trauma from a car accident, and so when I went
Okay.
to numb up her toe, she was just screaming and screaming. And I was like, "What's going on here?" And her mom had told me, "Yeah, look, every time she has like a needle, she just screams for no apparent reason." I says, "Okay, that makes sense." So the next time she came in, I had to do the opposite foot. Um, I says, "We're gonna tap," and I had her start tapping right here.
Uh-huh.
And I injected her toe, and she didn't make one scream at all. She was just, it's work. So uh, between
I see. How
chiropractic,
is that
this
different from EFT?
it's the same. It's the same tapping type,
Oh,
but it goes
thought
it
field
goes
therapy. Okay.
different, way at a different level. And in thought field therapy, there's a modality called the Dantians, where you work on the chakra area.
Okay.
Um,
Yeah. I
and you
know
do
about
it
the lower dantian.
you do the stomach, and then the pineal up here, and then the heart, and
Okay.
you do it for 21 days. But in TFT, you can actually do voice recognition technology, so I can actually see if um, develop a pathway or a tapping technique just by what the person is talking to me, and develop the code. So it's much on a deeper level from what you just mentioned.
Oh, yeah. Because you're bringing in intuition and a technique. That's
Yeah.
amazing. So what about treating fungus
Okay.
and stabilizing ankles? Yeah.
So stabilizing ankles, I use prolotherapy, but
Okay.
getting to the diet. So here's what's been even amazing for that book, Healthy Dad, Sick Dad.
Okay.
I put three diets in there. One is yin or weak, one is yang, strong, and then one is balanced. So in my book, in chapter 9, it's the immune diet. And when people come in with toenail fungus, their immune system is off
I
completely.
see.
And so I will actually get them on an immune diet, boost their immune system up. And with time, we can get rid of that fungal toenail with baking soda soaks and with proper dieting.
I
Um,
see.
with diabetes, there, chapter 10, I use for my diabetics. Now, diabetics can be both yin and yang, but usually they're yang. Usually it goes with the heart. So
Hmm.
ginger root, green beans, um, blueberries. These things I always add into their diet, and it's explained out what to do. And then the balance, the whole life diet is for the healthy person, which I do myself. But for myself, uh, I don't like the term diet because I don't that word die. It's just why diet when you can live it. So um,
Yeah, good point. Yeah, we're talking about these play on words, but it's true. It's powerful.
yeah.
So then
So
how do you,
I eat from my body temperature. You probably haven't heard that.
well, I have heard of drinking from the body temperature, but not eating.
Okay, so if I was in Alaska and I gave somebody a vegetarian diet, they would
Yeah,
probably get very
I'm from
sick.
Alaska, by the way.
Okay. Have you done a vegan diet?
I'm vegan right now.
And in Alaska.
Well, I live in Colorado.
Okay. So I guess the point I'm making is that during, the winter months, they need some more high dense proteins in their system. Okay.
Yeah, I
So
was not vegan when I grew up. Ate everything. I ate meat and yeah.
okay. Um, if and so and then their point is if you lived at the equator, you would probably not be eating steaks,
Oh, good
beef, and
point.
all that stuff. So my body temperature, the ultimate body temperature is 98.6. I know there's a debate about that, but if I can get it close to that, then I protect my immune system. And so I always run a little low, so in the 97 percentile. So I'm wearing a sweater. When I feel cold, even in the summer months, I will have chicken soup. Chicken soup actually elevates your your body temperature faster than beef will. And so I always try to maintain my body temperature to protect my immune system. So I'm never vegan. I'm never just Atkins. I'm never just,
Hmm.
straight this and this, but it changes from day to day. one day I will be vegan, one day I'll be vegetarian, one day I will be
I
Atkins.
see.
And so I will integrate according to how I feel. And so there's really more leeway. But my ultimate goal is not to lose weight. My ultimate goal is to protect my immune system so I stay out of the hospital, stay out of doctors' offices, and I just don't get sick.
Oh, that makes sense. So we talked about eating for your body temperature. What are some other things you do daily to keep yourself in balance?
So one thing that I start off with every day, I do my TFT tapping.
Okay.
So I do the collarbone breathing. I do my
What's the collarbone breathing? You hold
so you just
like
hold
this?
here and you tap right here, and then you use your knuckles, and then you go to the other side. And when you so like this, you breathe in, halfway out, all the way out, halfway in. And so usually you're tapping about 5 times on each segment. And
Hmm.
what that does is it neutralizes you from Wi-Fi, from EMFs,
Really?
from food toxins. Yes.
That's amazing. Everybody
So
needs that.
I mean, everybody that sleeps with their Wi-Fi on or they're next to the router, they should check. Um, there's a
I
way
always
to.
turn mine off, but it's on
Well,
during the day, like because I'm working.
you probably need the call. I would do the collarbone breathing.
Yeah.
There's an excellent YouTube video with Joanne Callahan that can show this on YouTube. But
Hmm.
so I started that out with that, and then I do a little daily detox mix that I talk about in my book every morning, and it's just it consists of red marine algae, blue green algae, sodium alginate, apopectin, psyllium, and green vibrance. Now, green vibrance is the freeze dried probiotics,
Oh,
and
I never heard of it.
then apopectin and psyllium are the bulk agents, the compounds that when you drink this with concentrate. So I have reverse osmosis water. I pour about 25 drops of concentrates, trace minerals, into the water. And then I take a teaspoon of that mixture and put it in there, shake it up, and drink it. So whatever toxins I had, whether it be Roundup from the air I breathe, from the food I ate, even though I eat strictly organic, you just don't know what you're getting. So it binds those chemicals before they start to take hold into your fat cells, and it eliminates them. And so it's just another way of protecting your immune system.
I see. I see. Well, in your book, you talk about a death experience that happened when you were in medical school. Would you like to share that?
Yes, so I was, trying to survive medical school. My diets consisted of root beer floats and Costco muffins. They were cheap, they were easy, and quick. And I ended up in the ER with kidney stones. I didn't know what was going on. I was bleeding blood, peeing blood, and it scared me. And man, it was painful. So they told me I had kidney stones, and so I had actually promised my brother I'd go home to his wedding, and I had another episode of a kidney stone attack. And my father says, "Well, just run down to the doctor. His name is Dr. Lindbergh, and have him look at you." And sure enough, he says, "I think you have a stone. Let's send you over to the hospital, and we'll do the dye study on you." And I says, "Okay." I had that, several months ago in San Francisco when I was in school. So I went over there. They injected this big bolus of fluid into my arm, and this time I had this awful taste in my mouth. And they went and took one picture, and then the lady that took a picture, something told her to go back and check on me, and she said I was so blue, and I stopped breathing, and they called cold blue on me, and I thought it was for about 5 or 10 minutes, but the medical report said they took 4 hours to resuscitate me. So, with your whole platform of Zen success,
Yeah.
I was researching what Zen actually means, peace.
Uh-huh. Yeah.
And I have yet to find another place than where I was.
Uh,
And it was the most peaceful, beautiful place I ever experienced. And I didn't want to come back. And then the thought came in, even though it made me realize, now I realize, okay, spirits can think and they can see and they can still hear,
Yeah.
but they can't touch and they can't taste. So the thought came in saying, look, you promised your brother that you'd go to his wedding. And so I asked to come back. And here I am to tell the
Oh,
story. So,
that's so beautiful. Well, it's been such a pleasure getting to know you and learning more about how you work with your clients and your incredible books, Healthy Dad, Sick Dad, What Good is Your Wealth If You Don't Have Your Health, and Luminary Leadership, How Top Entrepreneurs Lead in Business and Life. And I'll put your website and how to buy your books in the show notes. And thanks for being on my show, Dr. Robison.
it's been my pleasure. Thank you.
Thank you.
That's it for today's episode of Zen Success. Head on over to iTunes, Google Play, Spotify, or wherever you listen to shows. Subscribe to the show and share with friends. Be sure to head on over to ZenSuccessShow.com to help you on your Zen success journey. And join us on the next episode. May you find your own Zen success in life.